Hi, my name is Katrina Silva, and today I'm presenting a 57-year-old male with a chief complaint of dizziness. So some things that I think it could be are hypoglycemia, presyncope, labyrinthitis, vestibular tumors, specifically a neuroma. It could also be Chiari malformation or Meniere's disease presenting with vertigo. So I'm going to go speak to the patient, and he tells me that this has been going on for a little over 6 months. He can't remember exactly when it started, but it's been happening for a while, and this was the worst time that he's ever experienced this. He was driving to work and actually had to pull over because his environment was spinning. He did have one episode of vomiting, he was nauseous, and his left ear was ringing. He tells me that this lasted about 20 to 30 minutes before he called out and made an appointment to come in today. And that he's not experiencing any pain. He's still a little nauseous, but the ringing and the spinning has subsided. He also tells me that it's not radiating anywhere else in his body, and he can't exactly pinpoint a reason for this to be getting worse or offsetting an attack, but he does tell me that lying down makes him feel better. So when I talk to him about his family history, he tells me that his mother has a past history of hypertension, hyperlipidemia, and gallstones, and she's 86 years old. His father has hypertension, hyperlipidemia. He's a 30-pack-year smoker, as well as COPD, and he is 88 years old. His sister at 53 has hypertension, anxiety, and depression. On mom's side, grandma had hypertension, hyperlipidemia, heart failure, and she did pass at the age of 83 of heart failure. His grandfather he knew a little less about on that side of the family. He does know that he passed at 87 of a stroke. And on his father's side of the family, unfortunately, those grandparents passed away before he was born, so he didn't know a medical history on them. He tells me that during his childhood, he did have intermittent episodes of acute otitis media for the ages of 6 to 12, but this subsided as an adult. And that in his adulthood, he was diagnosed with hypertension and hyperlipidemia, as well as having rotator cuff surgery on his left shoulder at the age of 52. He tells me that his current medications are atorvastatin, carvedilol, multivitamin. He does take Tylenol as well as ibuprofen as needed for that left shoulder pain. He also tells me that he does have allergies to lactose. As a child, he was immunized against MMR, and he gets the yearly flu vaccine and has been vaccinated from COVID ×2. He tells me that for a social history, he does drink a beer once a day. On the weekends and socially, he drinks a little bit more, 2 to 3 beers. He tells me that he used to smoke marijuana in high school and college, but has since not touched that, and no other drugs are smoking in his life. He's married with children, is currently sexually active. He has no present or past history of STDs, and he has had 3 partners in his lifetime. He has a baccalaureate degree and is a newly retired police officer. He tells me that he goes for yearly checkups, the yearly flu vaccine, and he does make intermittent as needed appointments with a physical therapist for his left shoulder, and that he has had no military involvement. When I get a health history on his neuro system, he tells me that he denies all accounts of paralysis, involuntary movements, weakness, seizures, or syncope. But he does say that before the surgery in his left shoulder, he did experience numbness and tingling, but that has since subsided as well. So I'm going to go to my preceptor and tell her that I believe my patient does have Meniere's disease, presenting with vertigo, and I'm comparing this to Chiari malformation. So looking at the onset of the two, Chiari malformation has a very insidious onset. We used to think that this only affected adolescents and adults, but due to MRI advancements, we are finding this more and more in children. For the onset of Meniere's disease, we know that this has sporadic and clustered episodes. People can go into remission for a long period of time before having another attack, and this is also associated with hearing loss, which takes a very long progressive course before it's complete. Chiari malformation risk factors include Robin sequence, neurofibromatosis type 1, as well as Noonan syndrome. And Robin and Noonan syndrome both are congenital malformations that typically affect the face, specifically the nose and the mouth. Risk factors for Meniere's disease include having abnormal endolymph flow or resorption, hypoplasia of the vestibular aqueduct, as well as autoantibodies that are fighting against the endolymphatic sac. We have found autosomal dominance in 8 to 15% of these patients who have a first-degree relative that has had this severely in their lifetime, and we have not identified the specific gene for Meniere's disease yet. This is also seen in patients with recurrent migraine. The signs and symptoms of Chiari malformation, so there's quite a few for cranial neuropathies as well as brainstem compression, but I picked a couple that I thought were more important, such as hoarseness, vocal cord paralysis, any type of tongue atrophy, recurrent aspiration, central or obstructive sleep apnea as well. And then these patients will also present with scoliosis, syringomelia, presyrinxis, which is swelling of the spinal cord due to CSF obstruction. The most commonly seen sign is neck pain, occipital headache, and dizziness upon Valsalva maneuver. So anytime the patient sneezes, coughs, or laughs bearing down, this will onset the dizziness. And as well as cerebral dysfunction, presenting with nystagmus, ataxia, and scanning speech. So signs and symptoms of Meniere's disease comes in a triad of vertigo, hearing loss, and tinnitus. Vertigo will present with the room spinning or rocking. This is also where the nausea and vomiting comes in. The hearing loss is typically a low frequency hearing loss with fluctuations, and there's usually intense ipsilateral auricle fullness on that affected ear. It causes headaches, and it'll usually take about 8 to 10 years before full hearing loss is completely gone. Tinnitus is usually that ringing sound in the affected ear, and it can fluctuate or it can be constant. So to confirm these diagnoses for Chiari malformation, the gold standard is MRI, but we can also use a CT scan with sagittal resection if the patient cannot have an MRI. Unfortunately, this cannot be detected in blood work, CSF analysis, or tissue biopsy. For Meniere's disease, this is a couple of combinations of symptoms to diagnose, and those are 2 or more episodes of vertigo lasting 20 minutes to 12 hours. It's also going to be shown with audiometrical documented low to mid frequency sensory neural hearing loss in the patient, fluctuating oral symptoms in the affected ear, and the provider will not have another explanation for all of these symptoms put together. So this is why I believe my patient has Meniere's disease instead of Chiari malformation.